Time now for our weekly COVID checkup with Santa Barbara County Public Health.
Dr. Henning Ansorg is here with us today. Thanks for joining us live.
Thanks for having me.
All right, well, let's start with the Delta variant. We see what's happening where vaccine rates are low. What are we seeing locally?
Yes, Santa Barbara County is in lockstep with Southern California. We do have a surveillance program for the variants, and we are seeing a significant increase in the Delta variant. It's the sample size is relatively small, but we are seeing above 40% of all new cases in June were Delta.
And the vaccines, again, we want to let people know they do protect against this variant, correct?
Yes, we cannot stress this more often, and it is really the best protection we have. There's a 95% protection after the second shot, however. You need to have both doses. If it's Pfizer or Moderna, to get this 95% protection from severe illness or hospitalization due to the Delta variant.
LA County, they've had a big uptick in Delta variant cases, and they've been telling people to wear masks indoors regardless of a vaccination status. Could that be something that happens here, and at what point would we need to get to for that to be recommended again?
Yes, obviously Los Angeles County is a very, very big community. They currently have more than 4 million people who are not vaccinated. That's a huge amount of people. Their case rates are higher than ours. Therefore, I think it's a very appropriate measure to recommend for everybody indoors, like in grocery stores, banks, pharmacies, to wear a mask. It's a simple, very effective protection measure. We are considering this here locally, but we haven't pulled the trigger yet just because of our still lower case rates.
And we hear a lot about the long-haul COVID patients. They're suffering with months of symptoms. Do you have any idea why everyone has such a different reaction to getting COVID?
That is still, under investigation. Obviously, COVID is a very new disease, and it's very shocking. There are very interesting and, to me, really surprising new data coming out. For instance, after a normal respiratory infection, people have increased heart rate for about 4 days, and then it normalizes. After COVID, almost 3 months, and that's on average, which means the COVID virus does cause heart problems. And we don't know who is more susceptible and who isn't. And therefore, I would not roll the dice on that. I would just get vaccinated ASAP.
A return to school is going to be here before we know it. It's only July, but the end of August will be here very soon. Everybody that's under 12 isn't eligible to get a vaccine right now. So what do we anticipate the fall looking like as kids are jumping on the bus again and heading back to school?
Well, it will be very interesting. The CDC is coming out with official guidance actually tomorrow, and we will follow that CDC guidance. And what it will say is that in areas with a low viral spread, like Santa Barbara County at the moment, just wearing masks indoors is sufficient. No kid has to wear a mask outdoors. And so that's, I think, what we are looking at is that kids under 12 who can't get the vaccine, actually all kids have to wear masks indoors, but not outdoors. And then let me remind all the parents, 12 and up can get vaccinated. It's still time to get the 2 shots because the Pfizer shots are only 3 weeks apart. So that would be the safest thing to do, is get any kid that's over 12 vaccinated now.
Dr. Henning Ansorg from Santa Barbara County Public Health, thanks for joining us, and we'll check in again next week.
Thanks for having me.